We're day one of the Patient Safety Congress and Awards, and we're hosting a roundtable, HSJ, Nursing Times and Smith and Nephew, and we're looking at what can happen post-surgery when there are complications, and we're going to be talking to people about the strategies that they've got and if they bring about financial benefits for the patient experience, and also, of course, importantly, improved safety. Really excited to hear what people have got to say and really looking forward to the debate.
Smith and Nephew is delighted to work in partnership with HSJ and NT and support the Patient Safety Congress to improve outcomes, which is something really close to our hearts.
And today's discussion was really interesting. Huge amounts of, challenges for our healthcare professionals and also the facilities in making these improvements.
As a doctor, coming to these events I find very useful because there are certain cultural things that we can do, things that we don't currently do that well. They're not things that are normally taught in sort of medical school and medical training to try and reduce infections.
In our organisation, I was pleased to be able to report back to colleagues around the table that we have over the last year or so had a programme underway with a specialist nurse leading it to reduce our surgical site infection, and we have reduced it by about 25% with some fairly simple measures relating to ensuring correct antibiotics are given at the correct time, changing skin prep, making sure patients do have an appropriate cleansing wash prior to surgery, to keeping patients warm during surgery, and so on and so forth.
Coming from Northern Ireland, I'm used to working with an integrated health and social care system. Obviously that's not the case in England, and that's taken a lot to get used to, and I think it's also a pertinent part of the conversation of today's roundtable discussion, given that care seems to stop at the front door of a hospital on a patient's discharge, and we're not always sure of what the commitment or the skill set is of the people picking the care up of the patient in the community.
Teamwork was one of the big themes that came out. Clinicians working with surgeons, working with anaesthetists, working with nurses. So that was a real key thing to take home, along with trying to standardise practice within different trusts. Lots of different trusts seem to do different things, as well as different things within trusts as well. So trying to involve procurement in the standardisation of wound dressings, sutures for the patient journey to improve it.
Much of the incidents that I investigate within my role as a patient safety lead would say that there may be benefit from wider onus on the full team to find a way to really own that patient outcome and improvements and reductions in infections together, rather than it seeing as a particular professional role.
I think for me one of the main takeaways I got was an opportunity to focus on what might be perceived as incidents of harm that have lower impact on individual patients, but the frequency is very high. Therefore we have huge opportunity to widen out the safety and quality improvement work we're doing, which can lead to quite significant gains on a higher frequency number, which in comparison to some of the other areas of harm that we look at the moment, where the numbers are lower but the morbidity is high.
My take-home messages are that, first of all, we're doing many of the right things. Keep doing what we're doing. Keep pushing the message that, honesty and openness and integrity are the right things. Learn from mistakes.
A couple of things that really jumped out for me and that were really interesting in that discussion was accountability. So accountability of nursing teams, of medical teams, and of potentially also finance and procurement teams in the decisions of what products and solutions are used to embed within the facilities. But secondly, a key part of that discussion was around communication, how we improve that communication to improve the overall care of patients, whether that's within facilities or also between acute and community care.
Patient safety represents a continuing and increasing challenge for the healthcare system, which is often associated with significant human and economic costs. And wound complications, and in particular SSIs, for example, can double the length of post-op stay. Smith & Nephew have a range of products that help healthcare professionals address this challenge and improve outcomes, patient safety, whilst also reducing costs.